Hello and welcome to our webinar. This is a webinar that's going to be covering Reclaiming Futures, a model for communities helping teens overcome drugs, alcohol, and crime. And just to let you know a little bit of the logistics, we are going to have questions both throughout the presentation. There'll be some opportunities to ask questions both via the hand-raising function as well as the chat function, and you'll see in the slides a couple of times where there's a chance for a break to ask questions, so just look out for those. In order to have the webinar go smoothly, if you would move any cell phones or other electronic devices away from your computer, that can help with feedback issues, and also closing all your file sharing apps like in your Pandoras and things like that. That is also something that may be interfering with the quality of the PowerPoint. And then also if you're experiencing any audio issues, you can check your audio panel or feel free to chat to one of the organizers to see if these things are going. The recording of this webinar will be available on the Pathways to Positive Futures website, and it should appear within, I'd say about, within 24 hours of this broadcast. So that will be available to you as well as the slides, so you don't need to take notes. And so, without further ado, I'd like to turn this over to the Reclaiming Futures project, and they will talk more about their wonderful efforts. Thank you.
Thank you, Chris. Welcome, everyone. This is Susan Richardson, and I'm National Executive Director of Reclaiming Futures. We are a nationwide initiative to help communities help teens overcome the cycle of drugs, alcohol, and crime. We're based at Portland State University because that's where our founder picked, but we serve sites throughout the country, and we'll talk more about that. Today I'm delighted to be joined by Margaret Sokup. She is a project director of Reclaiming Futures at Seattle, King County, Washington. Next slide, please. So you will be guided today through our conversations and our experience over the last 12 years, and I'm just delighted to have my colleague Margaret on the webinar with me today. Next slide, please. I want to thank my friends and colleagues at Pathways and for this exciting opportunity. Pathways to Positive Futures, thank you for hosting us today. Next slide, please. We are going to have the opportunity for some audience participation, and we're going to have several poll questions throughout our presentation. But hey, the first one is, who is actually on the call today? We just want to get a feel for the audience. So if you take a minute to select all that apply, or perhaps the one you most prominently identify with. Are you mental health, substance abuse treatment or prevention, a child welfare or a juvenile justice professional, or other? So take a minute if you would, and we'll vote, and we will see who is actually on our call today, and that's going to kind of direct our remarks as we proceed. I hate it that I was only limited to 5 because I know we have some education folks on the line and others. We may even have youth and family. I hope so. But, you know, with technology there are some limits, and 5 is the limit. I hope you are voting. We're going to close it down really quickly here. And as soon as Nancy can give us the results, we shall review them. Look here, 30% of you are mental health professionals, equally divided between mental health and substance abuse. Fantastic. Child welfare, 15. Fantastic. 44 juvenile justice, and 22 other. That's a great audience. Thank you. Next slide, please. Hey, have you ever heard of Reclaiming Futures before? This one will be quick. Please check yes or no. We have been around since 2000. We started with the Robert Wood Johnson Foundation at that time. So if you would quickly select one, just yes or no. Hey, and guess what? Organizers and panelists don't vote. I like that one. I like that. I can't do two things at one time, so I can't vote. I just have to talk. Oh, fantastic. You know, we're glad in one way you haven't heard of us because you're hearing about us now. Thank you to the 58 and thank you to the 42 who have heard us. Next slide, please. And Nancy is just doing magic here, isn't she? Next,
Nice
we
work.
just have another question. Sometimes this is an interesting one, or most of the time. In your work, in your organization or network, is substance abuse treatment a partner on your core planning and implementation team? Yes or no? If you could select very quickly. We want to know, you know, who's at the table already. So if you would, select, and let's close that down. Excellent. 59% of you say yes. The substance abuse treatment is a partner in your efforts. 41% say no, and we may get to some opportunity how we can include them as a result of this webinar. Thank you for voting. Thanks for the quick polls. I personally like that interaction, and I love knowing more about the audience. The learning objectives today are to understand the need for a different approach and to learn about the Reclaiming Futures model and becoming a Reclaiming Futures community. And also, we're going to have the opportunity to find out about how Reclaiming Futures has been implemented in local communities across the country, including Dayton, Ohio, Anchorage, Alaska, and Seattle, King County, Washington, with our colleague Margaret. If at any time, say you have to jump off, just remember that we would love for you to check us out further or be in contact with us through www.reclaimingfutures.org, and we invite you to sign up for our free newsletter there as well. Next slide, please. This is a key question in our communities. How many youth that actually need treatment receive treatment? Could you take your best guess? Is it 1 in 5, 1 in 10, 1 in 15, or 1 in 20? And we're going to get going on our objectives for the day right after this question. This is a critical question, and please just give it your best guess. And when we're ready, we will close the poll and see what you have said. We have a very advanced class today, Margaret.
Yes, we do.
Indeed, we do. Next slide, please, or the next slide, because 47% of you got that right. The correct answer is the treatment gap is 1 in 20 youth that actually need treatment receive it. That is unacceptable. In fact, it's so large, it masses to 1.8 million teenagers needing treatment. And we know that there are over 343,000 young people arrested annually because they come to our attention first at the juvenile justice system. And that's why our model was created, to target that point in time. Now, even those who actually get treatment, that 1 in 20 that actually gets treatment, less than half of them get it for the recommended 90 days. And then research shows, and I know I'm somewhat preaching to the choir, that when young people use drugs and alcohol, they're more likely to drop out of school, get into fights, break the law, and get arrested. We know that these antisocial behaviors are results of use. Next slide, please. What we need is an alternative service delivery system. There are no national standards to identify needs and to deliver services for substance abuse, mental health issues in the juvenile justice system. That is the need that Reclaiming Futures has addressed. Some promising models are still regarded as specialty courts, but it has not been broadly disseminated in our field. What is evidence-based has not quite made it throughout the country, from science to service, so to speak. There is uneven use of evidence-based practices and really no standards to integrate the important professional services we provide in justice and treatment, and then other supports, the vital community supports in the youth life. Next slide, please. So our mantra, if you remember nothing else about Reclaiming Futures, I suggest you remember this. We are about more treatment, better treatment, and beyond treatment for our youth. More treatment addresses that terrible gap that only 1 in 20 receive treatment. So we want more treatment available to our young people. Better treatment means, is it the best science? Is it the best evidence-based that a community can pursue? Is it culturally appropriate and adolescent informed? Is it trauma informed? So that is our concept behind better treatment. And beyond treatment is very critical, and it is the part of the youth life that is beyond system involvement. When formal treatment may end, when formal system involvement may end, how do we engage that youth in the community and in pro-social activities that take the place of the previous lifestyle of use and abuse of drugs and substances? So more treatment, better treatment, beyond treatment is the Reclaiming Futures mission statement. Next slide, please. I mentioned that we are a product of the Robert Wood Johnson's Foundation's vision, and they are the largest healthcare funder in the United States, and they recognize this tremendous need and lack of organized evidence base to address a system of care in our courts. Our model and our original sites used the evidence that was available and did research to establish benchmarks in how to create this national 6-step model that we have. We used the 10 original sites over a 5-year period to develop and test the model and implement the model locally. And now we are trying to disseminate this model across the country. Next slide, please. I'm going to turn it over to Margaret, who's going to go over our model and tell us about how it works on the ground. Margaret?
Thank you, Susan. I want to talk a little bit about the model, and I just want to let everyone know that when we started, we didn't have this model. We had an idea of what we needed to do, but we did not have the model as we were starting this process. And in Seattle, King County, when we started, we had this experience with our juvenile drug court, and we had multiple providers, and everyone was using, some were using screens and some were using assessments, but it was pretty much all over the board, and it was very hard to compare assessment to assessment and really understand what the trends were in our community in King County. And so with Reclaiming Futures, we started with a standardized screen, and then followed with a standardized assessment. And the reason that was so important is part of what we found out in our juvenile drug court is maybe 6 months down the road when we were having these 15 different assessments, we'd find out that our kids have a co-occurring mental health issue. And usually by that time our prosecutor's pretty fed up because they're not making progress in treatment. And we, at that time, just a second, Susan, sorry, I'm working in a cubicle as well. And we at that time were moving too far along, and some of these kids would get kicked out of drug court. So, so the next slide, please. So the importance of a standardized biopsychosocial assessment was key. And this is something that actually has helped us to get further federal grants today. Next slide. So we're going to ask you another poll question in the middle of this model. How many youth in the juvenile justice system have co-occurring disorders? And that's mental health and substance abuse disorders. Please select one. And for us, this was really tragic because a lot of our kids probably went into our state institutions because we were not treating them adequately. And now that we have a standardized assessment, which is the GAIN, the Global Appraisal for Individual Needs, it's not a panacea, but it actually really describes where our kids are at with internalizing and externalizing disorders. So look, so we have 60%, wow. And I think this is, again, Susan, this is a very advanced group. And most of the young people that we've experienced in Seattle-King County, they walk through the door with co-occurring disorders. It's more rare that they come in with just a substance abuse disorder or just a mental health disorder.
That's right. Next slide. And Margaret, you're right. The answer from research is 50%, but the audience has identified it being higher, as have many of our sites have shown as much as 75% of their youth have a co-occurring. So let's give it to them. Let's give it to both groups, okay?
Well, I think that's because we have better screening and assessment than we've ever had, and I'm sure King County was not the only, or actually the state of Washington, we were not the only state that was using assessments that were pretty much created based on what the needs were for statute. And so now, since we have better screening and assessment, we're better able to identify the type of treatment that we need. And then the next step in the model, and step 3 is service coordination. So between step 1 and 2, if you screen a kid and they identify, or a young person, they identify as needing additional assessment, and then they get it. And then from that assessment, if there's recommendations for inpatient, outpatient treatment, co-occurring treatment, whatever it is, the next step is also easy to lose that particular youth in between assessment and actually getting the service coordination. So you may have an assessment, but how well coordinated is the treatment? And this is something that's very complicated and can be very messy between the juvenile justice system, mental health, child welfare, all of the different systems that are working with the same youth. Next slide. So when we talk about more treatment, in Susan's slide, it showed 1 in 20 get treatment that actually need it, and that's true in the state of Washington. But something that was really alarming when we were applying for a grant, it was 1 in 42 receive treatment in King County, and this is where we work. And it was very alarming because we thought we were doing such a good job, but the need far outweighed what we could provide. And so now that we have that information, we're able to move forward. So we need to provide more treatment because there definitely isn't enough for the need, and we need to provide better treatment. We can no longer use the adult models to treat our young people. Their brains are developing, they're different, and they need a different response. And so that service coordination, that initiation into treatment is really critical. And we're hoping during this time that we're also including community and other natural supports around the youth. Next slide. Engagement. Now we can test, I talked about the GAIN in this particular assessment, and we can actually test treatment satisfaction if the young person actually is engaged in treatment. And if they're not, maybe we need to change the counselor or change the intervention. Next slide. This is our beyond treatment transition, and I want to say that's the last step, but it's actually going throughout the entire model. One of the ways when I was the court manager in King County is to measure how many pro-social or positive supports beyond the systems were in the kid's life, was how many people that were not probation officers or treatment providers were gathered around the young person when they graduated. If it was only systems people, we missed the boat because the probation officer and the treatment provider have to move on to their next caseload. We need to have more community supports around our young people before they get out of our system and to transition them into the recovery world. Next slide. I think that's you, Susan.
Great. Thank you, Margaret. So the original site developed and implemented our 6-step model, and today we are a curriculum and leadership program, and we call it our Learning Collaborative, because together we are making system change happen for our young people. We have an independent evaluation that shows the model is working and some ongoing youth level outcome data to preliminarily show to youth. Over the years, we have had additional investments in reclaiming futures by the federal government, the Office of Juvenile Justice Delinquency Prevention, CSAT, that's the Center for Substance Abuse Treatment, and in North Carolina, where I came from and became involved in reclaiming futures, the North Carolina Department of Public Safety, the Kate B. Reynolds Charitable Trust, and the Duke Endowment. Next slide, please. So here is the map of the wonderful USA, and you can see the stars represent our 37 sites that have implemented Reclaiming Futures. We, of course, have the statewide effort going on in that red explosion of stars in North Carolina. There are now 12 sites, soon to be announced an additional site. And they are working on a statewide spread effort in North Carolina. Ohio has the second highest number of sites, and we are working on statewide spread there as well as in Massachusetts. But you can see that we are not in every state, but we would love to be. And if you are near or know of folks in our professional areas in these sites, we invite you to reach out to them, and of course there's information about how to connect with them on our website. Next slide, please. When we were looking at is it possible to make change for young people in the juvenile justice system, you know, can we know who has problems in our system, and can we ensure better outcomes for them? These were the questions that we wanted to know. And so next slide. We did have an evaluation funded by the Robert Wood Johnson Foundation of our first 10 sites. You can find the complete study online at www.reclaimingfutures.org, in which there were 13 indices of system change evaluated by Dr. Butts and Dr. Roman. And in our original sites, here we go, statistically significant changes were found in 12 of 13 indices. And the one that didn't move, if you're like me, you want to know that one right off, evolved around, or it was involved with partnership involvement. And of course, these sites were already at some level performing above average in collaboration and involvement, so it was harder to move the needle on that indices. But we did find that there was effective system change happening with our first evaluation. Next slide. Since that time, we are mining the information held in our GAIN site data. Margaret mentioned that the GAIN is the Global Assessment of Individual Need, and not only is it an assessor, a screening and assessor, it's a great evaluation tool. Not all of the sites use the game. They're not required to. But in the ones that do, which, by the way, are our federal sites, we are finding some very impressive youth-level outcome, and we'll be releasing this data later on in the summer. The great news is that juvenile drug courts across the country are working. The even better news is that the Reclaiming Futures model in the juvenile drug court are working even better. So we are seeing that Reclaiming Futures increases the days of abstinence by 42%. And there is a way to correlate future cost of crimes to society, and we are showing an average of $216,000 per youth per year. We all know inherently that prevention, even secondary prevention like Reclaiming Futures, saves money, but this is some quantitative data that is helping to make that case, and we will be sure and share this widely once it has been completely vetted later this summer. Next slide, please. Now, you've seen the model, and you know that we are asking communities to embrace implementing the model fully. The beauty of the model, as you may have seen from that map of the United States, is that it's flexible both in urban and rural settings. So one way that we do that and make it community-shaped is through a local team. And we call this group fellows, and I really believe that's kind of an academic holdover term, but it means leader of a particular discipline in the effort. And obviously we are trying to help youth have a better outcome and get treatment for substance abuse and mental health problems in the juvenile court. So to do that, we use the model. We use a judge, a community person, alcohol and drug, and I apologize, this should also say mental health treatment professional, juvenile justice professionals, and a project director to get the work done on the local level. Now, there are many other people that are appropriate to bring into this leadership team, but we had to draw the line at 5 fellowships. For instance, your public defender, your prosecutor, your local educators are all critical. Your child welfare professionals are all critical in wrapping services around these young people to give them a successful trajectory out of the system. So those local leadership teams have the flavor and the recipe that the local community deems appropriate. And community often is so large, obviously. Well, it's always a large concept. You need more than one champion there. These folks, as fellows, are champions for their discipline in helping kids reclaim their futures. Next slide, please. We've talked a lot, and we're just going to take a quick moment here for questions. We're about halfway through, and there will be more times for questions at the end. You can ask your question, type it in the message box, however you'd like to. And I'm sorry that some folks have had difficulty with the sound. I don't know what to say about that, but if you have a question, could you please type it in or ask it now?
Great, thanks. So we have a couple of some clarifying questions, and then we'll get into some others. When you're talking about treatment, are you talking about substance abuse treatment, mental health treatment, or both?
Both.
Okay.
And that is determined individually for each child by the assessment tool that is used.
We now have a question from Alia Rahman, and we're going to unmute this participant so they can ask their question.
Great.
Hello? You still there? Maybe not. All right. So in the meantime, you can ask this question is asked, what, if any, outreach and education do you do with police departments to inform them about the project?
That's an excellent question. Thank you for that one. We do involve the police because they are the front lines, and they are not a fellowship, as you noticed, but we all need to have a vision of what we can help youth with, what we can help youth with. The police department knows the youth in many cases. They can give us good information to the team about what, needs a youth and family might have. They are definitely a partner in the effort to reclaim kids' lives. We have had some communities pick the police department as a community fellow, and that often does not work because there are just some segments of our population that cannot trust the police due to various reasons. They are, of course, well-intentioned, well-meaning, trusty individuals and organizations, but there are some barriers that can prevent them from being an effective community fellow, but definitely a partner. Thank you for the question.
And Susan, I want to just respond as far as what we do in King County is it's not necessarily directly connected to Reclaiming Futures, but we have a strategy in the county that actually trains police officers in the academy on how to work with and de-escalate and communicate appropriately with not just young people but adults with drug and alcohol and mental health issues.
Excellent.
Another question we have is, how does your model differ from the trauma-informed care, or do you incorporate that knowledge into your model?
Great question. We definitely incorporate that model into our efforts because that is the state-of-the-art science. Our kids are affected by trauma at a very alarming levels, and this population is no exception. So that is absolutely part of our science.
We also have the caller who couldn't be heard actually typed their question in and is asking, are most of the teens in crisis in need of hospitalization long term?
I would say no. Most of them receive outpatient treatment. Now, obviously, we are trying to prevent them, divert them from actual detention. So most of the services for mental health and substance abuse occur on an outpatient basis.
Okay. We're going
Good
to
questions.
We're going to try another live question. Monica Bees, we have unmuted you to see if you can answer your question. Monica? You would need to unmute your own phone. I've unmuted you.
Well, maybe we can
Postpone.
have her at the next question opportunity.
Yes.
So maybe one more question, and then we'll move on?
Sure. Have faith-based communities been successful in helping with transitions, and what challenges have you faced in those communities?
Oh, that's a great question. I'm going to get to that in just a minute. Okay. Absolutely, they have been a tremendous asset in almost every community. They are a resource that are for kids. They want to do what they can to help kids, and they are wonderful partners. I'm going to talk some more about that as we go. So let's move on, and we want those questions. We'll have them again at the end. So please type in or be ready to speak when we get there, okay? And great segue to what happened in Montgomery County, Ohio. Montgomery County, Ohio truly had a vision for kids. They wanted a seamless system that used strength-based lens to help kids succeed. They were about youth success. And there are probably listeners on here that can tell this story better, but I have gained from their retelling and their experience. They were one of the original sites, too. They developed a program of natural helpers which are community members and are members of the faith community. They actually had a faith community fellow of sorts, but through every way they could find, they identified natural helpers for their justice-involved youth. A natural helper differs from a mentor in a way that the natural helper may be someone already connected to the youth's life, youth or family's life, as opposed to kind of a unidentified or a non-known match with a mentor. And they just helped connect the youth very successfully. I have some of their slides coming up, with a positive adult role model, be it family, coach, art, employer. They did a tremendous job with that, and obviously relied heavily on the faith community and cultivated those relationships successfully. Next slide, please. They believe that all youth can succeed and that we all share the responsibility, and that we can change systems when we change what people believe. Next slide. Through their implementation of Reclaiming Futures, which started in around 2002, and you can see this graph starts at 2006, and they have been able to reduce secure commitments to their Department of Youth Services significantly over this time frame through various efforts. We can't attribute it to Reclaiming Futures solely, but various efforts work very well hand in hand with Reclaiming Futures to achieve these results. Next slide. Now let me orient you just a little bit to this. This one starts in 2003, where they first started training their natural helpers. So the blue is the natural helpers they've identified and trained. And that is not a small feat. They actually were able to find funding to manage, train, and screen these natural helpers, to work with the youth referrals. You can see how it is a continuous process in that you identify and train your natural helpers, and then it is a continuous effort to try to keep those levels up. And you can see that there are more youth referrals than matches, and that is except in 2008, 2009, 2010 were the strongest years for youth matches and youth referrals. But they are just doing an absolutely fantastic job with this program and in leading the nation and, frankly, leading our initiative in this area. Next slide. Anchorage, Alaska was also a original site, and this is a lovely picture. I don't know if you can see the community holding the blanket. This is the Eskimo blanket toss. The youth is free in the air, just fully supported and covered by the youth holding this blanket. And this is a ritual that talks about the love and care around the youth in Anchorage. Many hands are together to raise the youth. Next slide. Every site is different and has a different experience, but when Reclaiming Futures started in Anchorage, it really was the unification of justice and community partners. They actually created operating agreements on how the youth were going to move through their system, and they introduced the team approach. Now that is probably prevalent in a lot of our courts, but we can all learn about how to do that better. They involve families, they develop positive youth opportunities, and brought in new partners to sustain the model, which is still going forward today. Next slide. I'm going to turn it over to Margaret, and she's going to talk a little bit more about Seattle-King County reclaiming futures.
Thank you. A few of the things that we've been able to do since 2002, and if I put it all in a package as far as what we've been able to sustain, is one, we have now a standardized screen that we use that's normed and validated, and it's the GAIN short screener. And we've also implemented the GAIN individual assessment, which is comprehensive. And we have sustained that, and actually it's not through federal funding, it's through our own sales tax that we pay for this. So you'll see some stats a little bit further into the PowerPoint to show what kind of data we have, and we have a very comprehensive training plan around that where we offer training ongoing throughout the year for new providers. We've also increased our science-based services. We now offer 7 challenges, trauma-focused cognitive behavioral therapy, adolescent community reinforcement approach. We have ongoing motivational interviewing training. So the evidence-based treatment practice has increased substantially since 2001. And a lot of that is through the initial grant of the Robert Wood Johnson Foundation back in 2002. We were able to send many of our providers to trainings that they've never been able to attend, and they came back with ideas on how to implement these evidence-based practices in their programs. The other thing that we've done is we've implemented a mentor program, and this mentor program is actually, it was the first time that the court, because Reclaim Futures started at the court, it was the first time the court actually had a contract with a faith-based coalition. And this group created a mentor program specifically for juvenile justice kids with co-occurring disorders, and the training was specific to that. We had other mentor programs in our communities, but they really did not know how to engage our kids and maintain them as far as relationships. And so this particular 4C Coalition is the name of the mentor program, is thriving today. The court still has probably about $50,000, not very much, that continues to go to the program, and they've been able to sustain themselves through other grants and other organizations that refer to them. So next slide. So this is just a snapshot of what we get from the GAIN, the Global Appraisal of Individual Needs. And I just want to let you know there's a family of instruments, there's screens, there's intensive screeners, there's follow-ups. So it's really evolved over the last decade, and really evolved based on the input from clinicians, really needing things to be tweaked and more culturally sensitive and appropriate. And so it's been an ongoing relationship with Chestnut Health Systems, the creator of the GAIN tools. So I just want to show you that N in the corner is over 10,000 gains we have actually administered since 2003. And that was initially just with the court kids. And so initially all of the youth that were assessed at the juvenile court had to receive a GAIN. That was the type of assessment that they were to receive. In 2005, my boss, Jim Vollendroff, actually expanded that to our entire adolescent treatment system across the public treatment system, and that's over 15 different providers, and we serve about 700 youth a year. So you can see the numbers are pretty high. The weekly alcohol use, and remember, these are primarily youth that are up to age 18. There are a few that are beyond that because we have a couple agencies that use the GAIN also for their adult population. So you can see the weekly tobacco use and weekly marijuana use is about the same. And this is an area that we have a lot of focus on around tobacco cessation, especially with the research showing that, you know, once our young people and our adults end up getting into recovery with whatever drug or alcohol that they're using, they continue to smoke and end up dying prematurely of lung cancer. So we try to provide education and smoking cessation, as well as treatment for the other alcohol and drugs. Next slide, please. So this is just to show you some of the slides that we have to show the high, medium, and low substance use problems, and this is also information we get from the GAIN. So I just wanted to show you a little snapshot that we're able to pull readily from our data from the GAIN. And so if you look at the end, we've got over 10,000 GAINs right now at intake, and you can see that our follow-ups are, the ends are a lot smaller. We've got 742 at the 3-month follow-up, 298 at the 6-month follow-up, and 94 at the 12-month follow-up. And that's because we've just recently mandated the M90, which is a 90-day follow-up to the GAIN to actually show changes in and progress in treatment. And so you'll see over time that we'll be able to better predict, how, not predict, but actually see the outcomes of how the treatment's working in our particular treatment providers level. So, so what we're doing now is we're hoping for the future that we will be able to measure beyond just treatment completion and engagement, because research shows that if you engage kids long enough, the treatment outcomes are better. But that was the only kind of measure we had. And now we'll actually be able to measure whether or not abstinence goes up or down, if school attendance goes up or down. So we'll have real outcome data in the future. Next slide. So again, this is just more data that we can get. And this information is cleaned and edited, and we have a quality assurance process, and so so this information is well vetted. And so you can look at any withdrawal symptoms, and again, we're looking at primarily youths that are under the age of 18, that they have 35% of them had any lifetime withdrawal symptoms, 17% had any past week withdrawal symptoms, and then you can see the 3% in the past week. Next slide. So this is the slide that has been most interesting for us to really change our field. Even though the GAIN is not necessarily used by the mental health side of our house, it really has informed the kind of treatment that we integrate into our substance use treatment centers, outpatient and inpatient. And so so when you look at this, you can see the high percentage of major depression, anxiety, suicidal thoughts, traumatic stress, and many of our providers actually just ignore conduct disorder because that's most of our kids, but also the attention deficit disorder. So this has been really great information for us, especially as we look at some of our treatment outcomes, and even if we're using some evidence-based practices, if they're not working, what we found is because the trauma is so much, through the roof with many of our kids, if we don't address trauma, some of these other evidence-based practices will not work if we do not do an intervention specifically around trauma. Next slide. So this is just an example of what we've implemented since Reclaiming Futures. So this is since 2002. So this is a lot of time, and it takes a lot of time, and we're constantly looking back at, how are we doing? What part of the model is weak? And some of that has nothing to do with funding. Some of it has to do with leadership, the political climate, as things move and change with the state budget and the federal budget. So we have just been staying the course, utilizing the model to keep us on track. So I'm not going to go into all of these, but if you have questions, let me know. Next slide. So again, showing the time frame of when we implemented the baseline of the GAIN assessment, which is really our first evidence-based practice. So we were able to identify what kind of treatment kids needed to get into. And then in 2006, we had several providers choose to implement the 7 challenges, which is very specific for adolescents, and it's a process that youth and their counselors can actually have dialogue through journals, and it's a very unique intervention, and it actually has great outcomes. And then we've got MRT, which is moral reconation therapy. That's primarily for adults, but some of our providers use that with youth. And then we have, in 2010, through federal grants, based upon our GAIN data, we were able to successfully obtain. We were able to implement ACRA, which is the Adolescent Community Reinforcement Approach, and the Community Reinforcement Approach is for adults. Also, in that time, we were also able to implement the trauma-focused cognitive behavioral therapy. That's when we were really discovering the trauma that was really through the roof, especially for the justice kids. And now we are offering ongoing motivational interviewing, clinical supervision, and treatment planning. And this is part of our workforce development plan that we revamp every year. Next slide. So again, this shows another angle. If you could look at the green, shows the length of stay in King County for our youth. And if you look at the yellow, it's the median length of stay by the state. And you can see ours, it's continuing to go up. And that was really the only thing that we were ever able to measure, is really the dose of treatment kids were getting. And as you can see, as we've been implementing these evidence-based practices over the years, the treatment retention has gone up. And we're looking forward to getting more information about those outcomes with the M90. Next slide. So we can't say, and this is the same with Montgomery County, we can't say because of Reclaiming Futures that our secure detention population went down. And actually, if we were able to put 2011 and 2012, that number would have gone down to about 50 or 60. But we do know that it has really impacted the type of treatment that our young people get. Next slide. And you can see the same trend going with juvenile offender filings, and they are also down from the 3,000. They're down into the 1,500 to 2,000. Next slide. So that is the King County story. I didn't get to talk a lot about the beyond treatment, but I wanted to speak a little bit about beyond treatment with another one of our sites in Washington. In Snohomish County, we in King County have a really solid mentor program that's formal, and it's been very effective, and we are so grateful we have it. Some of the remarkable things that they're doing in Snohomish County is really around art and music, and so they have a program called Pairing Artists in Recovery with youth, and this is just one piece of the work that they do with volunteers that pair up with kids that are in recovery. They have a calligraphy class, they have music futures where volunteers actually meet with the kids on the weekend, and so for a pro-social activity, instead of perhaps going to Alcoholics Anonymous, they go to a music session and they learn how to play the guitar. The kids that I've talked to that have gone through that really find that very healing, and it's something that they are very grateful for. So these are just some of the ideas that are around the country in Washington State, and then there are others. Susan and I talk a lot about, if you've seen one Reclaiming Futures site, you've seen one, because they're all very different, and you really pull from the strengths of your own community. And that's why it's so easily implemented in every community, I think. Thank you.
Thank you, Margaret. Next slide. So communities who want to formally become a Reclaiming Futures site would receive our full technical assistance, such as a coach. And Margaret is a coach across the country, and currently is that Snohomish County coach. We provide a one-to-one coaching relationship to our sites. In addition to a toolkit curriculum that the local team with the fellows work through, we ourselves do our own webinars and trainings, and we have an annual Leadership Institute of all fellows. Those fellows in each fellowship have a regularly scheduled call for support, advice, and troubleshooting The project directors actually meet monthly, and the others, the judge, probation, treatment, and community, have a quarterly call. So these are the benefits of becoming a Reclaiming Futures above and beyond the National Learning Collaborative that you would learn from other sites in your state or across the nation. Next slide, please. The challenge is great. Do you all ever feel like you're pushing this big box into the truck? They are great, and it is hard work, but it is the essential work that we are about. We are about system change for youth. We can use our model to effectively know what youth need as far as treatment. We can use the model to keep track of them. It's not rocket science, but it is so important that we frame it in such a way, and Reclaiming Futures can be that tool to help you frame a way to track and know what kind of outcomes our youth are achieving in the justice system, and then expanded to the larger community. Next slide, please. Well, we have made it to the question part of our program, and while you are getting ready to answer those questions, let me just say, in case people have to jump off, next slide. Here's a screenshot of our website. Please go there. Please sign up for our newsletter or contact us if you'd like additional information. Next slide. We're at reclaimingfutures.org, and then Margaret or I, either one, would be delighted to talk with you later. But let's open it back up to questions. Chris?
Great. So the first question I have is sort of a combo of a few people's questions, which is, could you talk more about the ethnic background of the youth that you serve, specifically looking at communities of color, but then also possibly have you been successfully ever working with any tribal communities?
Oh, that's an excellent question, and I'm going to start it, and Margaret, would you please follow me?
Sure.
Our children of color are disproportionately represented in the justice system. Our children of color are disproportionately detained in our system, juvenile justice system as well. And we are trying to keep youth out of detention and into treatment where appropriate, so that they don't get pulled deeper into the system and have a longer career with drugs, alcohol, and crime. This phenomenon, so to speak, is called disproportionate minority contact. It is a very prominent part of what we are trying to work to eradicate, and many of our sites have also been working with the Juvenile Detention Alternatives Initiative to make a difference in this, because it is absolutely a disparity that we cannot live with. Secondly, we have had 2 tribal sites. Thank you for the question. One is in Rosebud, South Dakota, and the other is the Cherokee Nation in Tahlequah, Oklahoma. And each of these sites have had just such unique assets accompanied by such unique challenges, but it has been a pleasure to try to work with them on behalf of their youth. Margaret?
In King County, primarily, our youth, our African American youth and our Hispanic youth are disproportionately represented in our system, and we have been responding with specific treatment and trying to adjust the treatment, and primarily making sure the counselors are well trained, and also potentially just match the youth. So we're making progress, and we actually have pretty good outcomes with our evidence-based practices with youth of color as well.
Another question is, how do you ensure that your program is implemented with fidelity across your sites?
Wow, that's a great question. We have implemented a I shouldn't use the word implemented, because that's key to this answer. We chose not to do a fidelity scale, but the closest thing we have to it is an implementation index that a local community uses to form an implementation plan, which is their roadmap for implementing the model. We had to find a tool that allowed for the strengths and opportunities that vary from site to site, and we feel that this implementation index developed by our sites, asked for by our sites over our learning history, is our best effort at fidelity and is continuing to evolve. Great question. Thank you.
All right, this will be our last question. I'm going to kind of weave a couple in again. How do you, when looking at involvement within the communities, how do you incorporate or can you incorporate either family involvement or school involvement in any of your efforts?
That's a great question, and we don't have a family fellow or a education fellow, school fellow, but they are included in our concept of community, and they are critical. We want to learn from our wraparound professionals about how you must have youth and family voice at the table. All youth and families have strengths, and we must involve them, and we incorporate that, you know, to varying degrees at each site. And secondly, you know, our children need education. We have to work with education to ensure that our youth have a future. And so in almost every site, we have that involvement. And I know in every site we promote that involvement. But you've seen one Reclaiming Future site, you've seen one educational system. So our sites are in a community in the larger context of the educational services provided there. And some of the most powerful partnerships we've had have come from the aligning of vision between the schools and Reclaiming Futures. Margaret, do you have anything else you'd like to add?
No, I think that's good.
Well, I want to, if there's a way we can encourage or continue these questions and conversations, I'd be happy to do that. But I really want to thank you, Margaret, for helping us today, and thank you to Pathways so much for having us, and thank you to the audience.
And thanks to everybody, especially Susan and Margaret. So we are going to be capturing all the questions that were asked and sending those off to Margaret and Susan, those that were especially that we didn't really get a chance to answer.
Great,
and
thank you.
You're welcome. And again, this broadcast will be available on the Pathways website, and we'll make it so that it gets linked to the Reclaiming Futures website as well. And thanks to SAMHSA and NIDER for the funding, and thanks to all of you for attending, and have a great rest of your day. Thank you so much. Goodbye.
Thank you.
Thank you.